You know, a lot of people made a New Year's resolution to lose weight. It's not just about vanity, though. Losing weight can help with medical conditions like diabetes, high blood pressure, cholesterol, too. Matthew Tucker is a physician assistant with Novant Health Salem Surgical Weight Loss. And first off, good morning. Thank you for coming in.
Well, thank you so much for having me.
We have heard so much about weight loss drugs. I imagine those are kind of the thing everybody's talking about.
Oh, yeah.
Are they kind of the easy way out, or what? Tell me more about how many people are using these?
Well, I think a vast majority of the community could benefit from using it, that's for sure. We're seeing more and more growth in our office and in our area. Yeah.
Some of the names are Ozempic and...
Ozempic and Mounjaro, it's good to make a distinction between that class of drugs, which is branded for diabetes treatment, type 2 diabetes specifically, and Zepbound and Wegovy, which are the drugs that are branded for weight loss specifically.
Okay, so people come in and they start on what kind of change have you seen from people?
Oh, well, patients can expect to see, with Zepbound, the newest one, they're claiming up to 20% of their body weight reduction over a 72-week period, which was the study length. Yeah.
So the first question a lot of people would have, or is it safe?
Oh, absolutely.
And I'm sure, naturally, you're not going to be prescribing something that's not, but it is, and it's been tested. Who might have a problem with this, though?
So anybody who has a prior existing GI upset condition, irritable bowel syndrome maybe will have some, but some people do just fine on it. Primarily when you're taking these medications, those are going to be the types of side effects that you notice early on. They're mostly mild and mostly resolve over the course of being on the medication for longer. If you have anything that's more severe than that, we definitely want to know about it, and it's a good opportunity to discuss the other options that are available.
So how often do you take this? Is it first off, is it injected? Is it a pill or what?
Yeah, these new medications, they are injections. They're taken once weekly, which is nice. It's not a daily pill, which detracts a lot of people. And so it's given to yourself either in your thigh or your stomach, and we talk about that in our visits.
And you talk about over a 72-week period. What kind of, say, a month? How much are people losing with this?
Well, that can be different for different patients. And the main reason there is you don't start on the highest dose that was studied. You start on a lower dose, and you sort of gradually are building up over the course of several months. And so I like to aim for about a half a pound to a pound per week to start out with, just to keep people in that motivated spirit, allow them to kind of continue the program, not get their hopes down. I feel like everyone has a goal. I try to remind them that their goal for any kind of weight loss changes is actually long term. Nothing like just a couple of months down the road.
What about cost? And I think that's the factor that a lot of people don't focus on.
Yeah, so the big question there is whether or not your insurance will cover it. If your insurance covers it, a lot of the times the cost is very affordable. The companies claim, as low as $25 utilizing their coupons that they provide through the website, and I would send people to their websites to look into that. Without the coupon,
if they don't cover it.
Yeah, without the coupons, these medicines just base are over $1,000 per month.
Wow.
Yeah.
So you really have to, and apparently a lot of insurance companies are taking a second look because they've got so many people that are on these.
So many.
So ask those questions, and I guess you can help people answer those questions. You can steer them in the right direction.
Absolutely. I want to make sure that everybody's well informed about the medication options, not just the newer ones, but the older generations as well, what their risks and benefits are with those, what they can expect to lose, but also strongly sort of steer them towards a healthy lifestyle adoption in general.
If you can't take these or can't afford them, there are plenty of other options.
Yeah.
And things that have worked for a lot of people in the past.
The main thing is to make sure everybody adopts a healthy lifestyle, and we have people in our facility that can help you with that too.
Thank you so much. We appreciate you coming in.
No, thank you so much.